Well, welcome. Today we'll be talking about if you have looked at how to create a systematic review. In this session, what we'll be doing is we want to say how you collect the data on these parts. So imagine you have a topic which you are looking into, and then in that topic, you have pulled the data, or you want to pull the data after you have selected the particular articles. The goal is that we watch a previous video when we talked about that you have to upload it into you have to register on Prospero and then do your search strategy and so on and so forth. And idea is that by the time you watch this video, you have already done the selection of your articles. Then Dr. Gautam is going to share a screen with us too. Once you have selected the articles, what data points you have to take out. So Dr. Gautami, can you please share your screen? The goal is that your studies has to be in the rows. You create your columns for the data points need to be collected, and in these columns you put down different characteristics of the studies. Each study has a one row, and you're collecting data in one row. So the most important thing is you want to have your title of the project, so then you can identify and go back and update it. We suggest using Google Drive and so on and so forth. Here, the example of COVID NAFLD data abstraction. You want to know if you have studies numbers in your own record, you can put down there. You definitely want the first author name there, because then that's where you create your forest plot, which will show you later on. The DOI, which is a unique identifier, you want to keep it and copy it so you can always go back to that particular article if you need to. Year of publication, study design, they're important factor. You will use them into table 1 when you show that how many different articles were there. And the most important part is, remember, this was the study of COVID NAFLD, where you have your exposure group and control group. So control group is no NAFLD, exposure group with NAFLD. So these are the denominator, total number of patients included in that particular study at that time. And then if your primary outcome is mortality, in this case, it was a mortality in exposure group, mortality in control group, mortality in exposure group. That is something very important. As you have your outcomes, you want to make sure that you write down the raw number of those things. In this study, we end up having another outcome of length of stay. Those who have watched our videos, you know that mortality is a nominal variable. It'll create an odds ratio in that capacity. Length of stay is a continuous variable, so you'll be writing the value of the mean reported in that particular article in this particular group. 10.33 days, 10.4 days. Sometimes they give you median IQR, sometimes they give you range. There are formulas you can use on internet where you can turn the values given in these papers as resultant median IQR or ranges. You can turn them into mean. That is something we want to point out, that you have to list your mean standard deviation here if it is possible. Then you go forward, you put down other secondary outcomes which will be used to analyze the data. Now, inclusion criteria, who collected the data, this is for yourself to manage it, which journal they were in, which country, which study period, and other details. Will not go too much detail. Goal is to keep it comprehensive, that you need all that detail to show into your table 1. You don't show your mortality and all because the forest plot will cover it, but any other details you think is important for that particular topic, or it's been previously published in other systematic review meta-analysis, you want to collect them. You want to collect them once and making sure there is a consistency. Here, sometimes you see that we have more than one value. Let's say range is given and all, or their brackets, and so you want to keep it kosher. You want to have one data point in one cell, so it's easy to analyze and so on and so forth. And sometimes you have to give those things because you're not going to analyze them just as a part of the table. Now, I would like to show you the forest plot. Well, for the initial 4 data points, we showed it to you. So the Gautam, if you want to share the forest plot created by using the mortality.
This is the forest. This is the.
So it's a Prisma diagram, which we will go into detail, but based on the data you have collected now, this is the way you will be able to create a forest plot, or somebody who knows how to do this one, they should be able to create a forest plot. You see that here it has been utilized, and I'm just going to mark it for you. The study subtype, like who was the author, and then what year it was, your denominator of your exposure group, your control group, the total number of people, and then total number of people, like how many people died and what number of people totally were, the weighted for each study from total population, and then hazard ratio, odds ratio, and then your forest plot around it as well. That's where you created, and then we can go into different details like heterogeneity and other things. What was total population? What was the total mortality? Based on the data you collect in your study, this forest plot can be calculated, and then you should be able to actually create the results for your systematic review and meta-analysis. So let's unshare our screen. One point is, this is our second part. Once you have done your analysis, once you have done your initial study selection, this is the way you need to collect the data. We'll talk about more how to create your Prisma diagram. We will have a topic about how to update into Prospero, and then we'll talk about how you write it up in upcoming segments. Thank you so much for watching. Needless to say, please like, subscribe, and write in comment section what you liked about it.